I am Movina Vijaykumaran here. So today me and my group are going to present about nursing home subject. So according to my part, introduction of law and certification of nursing home institution Malaysia. So I'm going to explain about nursing home to y'all. As we know, nursing home is a place for one live and also known as a long-term center. Other than that, they are also known for skilled nursing facilities, care home, rest home, and also old folks home. So when it comes to nursing home, it is a protection or treatment of human response in the care of individuals, families, communities, and also populations. Even in UK, United Kingdom, we have law and ethics and also certification for each of the long-term facilities which is to clarify the boundaries of professional practice and guidelines. This is also to assist a healthcare professional for legal and legislation areas and to be aware of. Comes to the law and certification, we know the Omnibus Budget Reconciliation Act, OBRA, which is also known as the Nursing Home Reform Act of 1987, which this act is dramatically improved the quality of care in a nursing home, which is over 20 years. So how care should be provided to the residents. So this is also signed into the law by President Ronald Reagan, and this is the fourth new provision for medical and Medicaid sections related to new standards for care nursing home settings. Other than that, this OBRA is also for Omnibus Budget Reconciliation Act. The primary purpose of a compensation plan is to provide a treatment and also retirement alternative to social security for all non-benefited part-time, seasonal and also temporary employees. Other than that, it is also referred informationally for the Nursing Home Reform Act, but more commonly it is just OBRA. And OBRA's purpose is to improve the quality of care in nursing homes for the health and safety of nursing home residents. So this is also legislative and legal controls have helped clearing the boundaries of professional practice and also to protect clients. Thank you.
Hi, Assalamualaikum. My name is Anis Amira Nasha binti Muhammad Hamdi. My matric number H17A0026. Today, I would like to present about law and certification of nursing home institution. In 1986, the Congress has asked the National Academy of Medicine, which is before this were known as Institute of Medicine, to analyze the state of nursing home in UK. It is because the Congress suspected that many nursing homes in UK were not providing high quality to senior. The result were proof that many nursing home residents were not receiving adequate care. After the study, National Academy of Medicine has recommended a reform for nursing home. The Congress has used the National Academy of Medicine recommendation to write the Nursing Home Reform Act. The Nursing Home Reform Act was passed in 1987. This landmark federal legislation comes by its common name, OBRA. OBRA were known as Omnibus Budget Reconciliation Act by legislative process. This act creates a set of nominal minimum standard of care and rights for people that living in this certified nursing home. There is a few objectives for Nursing Home Reform Act. One of the Reform Act is to secure quality care in nursing residents and establish a resident Bills of Rights. A Bills of Rights were defined as basic rights for nursing home residents. According to the Nursing Home Reform Act, nursing home resident has certain basic rights, including the right to necessary care like medical, physical, psychological, and social. It also has right on privacy, security of possession, welcome visitors or refuse visitors, remain in the facility until transferred to discharge, participate in resident and family groups, be treated with dignity, exercise self-determination, and many more. Nursing homes that violate this right will be subjected to legal action. That's all from me. Thank you.
A very good morning, Doctor. My name is Durganandini, Doctor of Muthukumar, and today I would like to present my part, which is entitled Impact of Nursing Home Law towards Employee and elderly people, which have in United Kingdom. Okay, first point is providing a proper nursing care services to the elderly people. The second point is giving out a compensational and turnover intentions toward the employee. The third point is giving out employee provident fund. It's known as EPF. Okay, today I would like to talk about the three impact or three benefits about the three main elements. Okay, what are the benefits by providing a proper nursing care services to the elderly people? First, United Kingdom law, nursing home law, they provided a lot of facilities in order healthcare facilities towards the elderly people. For example, give out 120 beds per month towards the nursing care home. And then second thing is they are like enable the older people to access a lot of medications, a lot of healthcare things. For example, is giving out a lot of masks and glove, face mask, right? And also giving a prepared consultant towards their main care of things like mental, physical, and health services. Having a campaign towards the elderly people, giving out social services, care, and proper access of healthcare pampered, right? And also take care of their okay. The second point is, doctor, like giving out compensational and turnover instantations that is divided into two elements. First is benefit order, second is non-benefit order towards the employee. So the benefit order is like giving a company or organizational normally giving compensations that combines both, as I said earlier. The benefit like a bonus, paid leave, holiday, salary, leave, annual leave, some things, right? It's not a benefit. The non-benefit is giving our certificate like insurance, retirement plans towards the employee. So the motive of two compositional, the motive of two ingredients is like motivate the employee to recreate their performance, to like whenever employee like receive a lot of incentive in order benefits, they will motivate their daily performance in the company. And then the second thing is the third point is employee provident fund. It's not an EPF, right? The main purpose of giving out EPF is like encouragement towards the employee, like giving out incentive, right? For example, if an employee like working in order 10 years, 20 years in a company, after retirement, they will access of EPF. EPF are like retirement plans towards their daily life, like supporting system in a like providing a supportive ecosystem towards them. Right. Thank you so much, doctor.
I'm Vinod Ganesan and my METRI number is H17A0350. In this video, I will present about the certification of the personnel. Many healthcare and support services can be offered beyond the conventional healthcare system, such as hospital, a qualified nursing home, a rehabilitation center, or a long-term care environment. Home health care may be provided by licensed medical personnel such as physicians, registered nurses, medical social workers, and unlicensed but certified workers such as home health aides and personal care aides. Okay, first will be administrative, which is well known as physicians. Though physicians do not often offer direct health care at home, They administer patient care, diagnose and monitor illness, and prescribe medication and treatments. Doctors graduated from a bachelor's degree program in a medical school. They passed a licensing test in their own state. Both physicians must be aggregated within the state in which they practice. Many physicians already have specialty certificates. And the second will be Home Health Aide, or in short form HHA. Under the supervision of a nurse, the HHA offers compassionate care to patients in their homes. They work to improve or preserve the freedom, wellness, and well-being of patients. HHAs provide or assist with self-care tasks such as bathing, dressing, shaving, toileting, feeding, skincare, medical supplies and equipment such as walkers and wheelchairs, and assistance with light housework, laundry, and home protection.
Hello, hi, Assalamualaikum. My name is Nur Arina binti Abdul Rashid. I'm a student of University Malaysia Kelantan with matrix number H17E0415. I'm doing my bachelor in entrepreneurship in wellness or health. So today I'm going to present a little bit about nursing home, which is one of my subjects for this semester 7th. And this is a report assignment, grouping assignment, and I will continue presenting what my friend just now have been presented, which is a personal certification. There are several personnel that certificate to take care of the patient in nursing home that I want to talk about. So the third point is personal care attendants, or PCA. Under the nurse in nursing home, there is a PCA that responsible to provide self-care to the patient and more to companionship. They also do the housekeeping chores, for example, cleaning, washing clothes, washing dishes, and also cooking meals. And they will do everything that needed in housekeeping in nursing home. And personal care do not conduct any kind of medical services as the home health aide may do. Other than that, sometimes PSC are responsible to assist a registered nurse and giving out or report to them about the patient's daily activities. The fourth one is a registered nurse. So the registered nurse are doing plan and monitor the treatment of the patient in the home health department. A registered nurse also conduct assessment and monitor tests and laboratory results, prescribe therapies and also medication, and they are also monitor the patient condition and provide education to the patient and also a family. A registered nurse supervise a licensed practical nurse, home health aides, and personal care aides. And that is why registered nurses are allowed and could give a medication to the patient compared to a personal care attendants. Last but not least is the very important role in nursing home is a social work assistant. So a social worker is work with the patient in giving support services, for example in counseling, advising, financial assistance, and also a community services. A social worker provides emotional support to the patient and the family, and being an advocate to help meet the patient's needs.
Okay, hi, my name is Hanisa binti Rosli. My metric number is H17A0055. Okay, so now I will present my part in question 2D, which is the development of the certification of the personnel. In the United Kingdom, this care system begin with the provision of a private and voluntary sector that move on to a longer level to the public sector. This statement has been written in Department of Health and Wage Office 1990. Nursing Registration Act 1927 is the first law prescribing the usual registration procedures. The application is accompanied by payment, registration, certification by laws on registration and certification of deed, as well as the power to inspect. This statement has been written by Abel Smith, 1964, in Department of Health and Wage Office, 1990, and in HMSO, 1990. The legislation also provides the first definitions of nursing home and maternity home appearing in the law. Nursing home means any premises used or intended to be used for the reception and provision of care for persons suffering from illness, injury, or weakness. This statement has been written in Nursing Home Registration Act 1927, Section 10. The Nursing Homes Act 1975 delegate power for registration and inspection first to area health authorities and later to district health authorities. Further legislative amendments followed, and the types of regulated premises, including those offering medical and surgical services, expanded. Amendments made to the Nursing Homes Act 1975 and the Health Services Act of 1980 also related for the first time to the qualifications and residency of the person in charge of the home and the level and qualification of nursing staff. All nursing homes had to be in the charge of either a registered medical practitioner or qualified nurse, or in the case of maternity homes, a certified midwife. The Health Circular HC 818 outlined that where a nurse was in charge of a home, they had to be a registered nurse, and health authorities were able to determine staffing levels given the number and types of patients within particular homes. Okay, so that's all from me. Thank you.
My name is Ranjita Marutandi. Matrix number is H17A0291. Now I am presenting the development of certification of the personnel. In the Royal Commission on Long-Term Care 1999, 13 to 14 DOH 2001 upgrade more efficiently the quality of nursing home like service development. The legalization increased pressure on long-stay hospital beds, more effective use of acute hospital bed. Then the development of intermediate care and rehabilitation services, and also increased direction through National Services Framework for Elderly. Apart from that, the National Minimum Standard for Care Homes mentioned that staffing is a pivotal for a nursing home. All the registered nurse and unregistered nurse must have National Vocational Qualification Level 2 or equivalent by 2005 in UK. This development of the certification of the personnel is mainly to take care the elderly people more effectively. Nursing homes in UK provide the training and development of staff essential to ensure good practice and the provision of a quality service of residents. The main concern all about is safe working practices to ensure that the health, safety and welfare of residents and staff are promoted and protected. Plus, this include moving and handling, fire safety, first aid, food hygiene and infection control. Now I call upon the next presenter to present. Thank you.
Hello sir, my name is Tanasilan Armugan. My matric number is H17B0401. Today I want to continue with present the development of certification of the personnel. So the first one, according the England Community Care Act 2003 requires the local to reimburse the National Health Service. Thus, for each day an acute patient's discharge is the delay due to the sole responsibility of social service, either in making an assessment for service or provision of our services, the management pay for their performance, make it people trust on their work to improve the system. For example, management can give some rewards like allowance and bonus. The next part is elderly protection policies and instruments are the most important thing to develop the certification personnel in nursing home. According a 2009 national project named Action and Elder Abuse Task Safeguarding Teams in Local Council with responsibility for raising alert in case of abuse and monitoring the effectiveness of local authorities and preventing responding to cases of abuse. The Independent Safeguarding Authority receives referrals concerning cases of abuse. In conclusion, the UK nursing homes rules and regulation or culture of the institution often stand in their way, but action plan is that care for elderly people must be compassionate and respectful of their dignity and self-esteem, and also new generation of elderly people have different presence and expectation of care. So, for the next part, my friend can present the benefit of the law and certification in the chosen country.
Assalamualaikum and good day to Dr. Hasif and my fellow friends. My name is Nur Shahirah Binti Aziz. My metric number is H170155. So I will continue the presentations. I will present about the benefits of law and certifications in United Kingdom. There are 3 benefits of law and certifications in United Kingdom. Firstly, the quantitative and qualitative nursing home in UK more regulate. Each facility in UK was need to have a quality evaluations and assurance committee consisting of a practitioner and 3 staff. To fulfill the role of the social service department, hospital with more than 120 beds should provide at least 1 full-time workers with a bachelor degree. Professional nursing home facility have been made responsible for preserving and improving the quality of life for its patients. The second benefits of law and certifications in UK is priority. OBRA 87 define the chains of quality care to provide the standard, survey, and enforcement system as a 3 basic aspects of the system. Performance measures continue to be measured by the patients themselves, by their clinical conditions and overall report of their personal quality of life, instead of quality measure focus on care provided by nursing home employees. In addition, its emphasis not only on health effects but also greatly increased understanding and commitment to resident mental health needs. Lastly, the benefits of law and certification is the status and role of the nursing home. The provisions specifically that's open admissions, evaluation, advocacy service, and verifying the intrinsic importance of the person apart from their facility and procedure. Moreover, each resident must be made aware of their rights within their establishment. That's all from my part, and then I will pass to the next presenter.
Assalamualaikum and hi everyone. So my name is Nur Anizatul Azna binti Omar. My matrix number is H1780202. So I will continue the presentation and I will present the conclusion. So the care standard for nursing home aim to provide and improve the quality and consistency of care for people living in nursing home. In United Kingdom, there are several laws that are standardized to all nursing home or long-term care service. Okay, in United Kingdom, they are implement the Nursing Home Reform Act that passed in 1987 and also known as Omnibus Budget Reconciliation Act, OBRA 87. This act are help nursing home to improve the quality of services. The law will impact the nursing home service by providing proper nursing care service and compensation and turnover intention regarding legislation law towards employee in nursing home. In the nutshell, the standardized of the quality services in nursing home at United Kingdom to provide the best service as well as to improve elderly health while help the employee to keep improve the quality of work. The quality of services can benefit the country also in terms that they provide law and certification by improving the quality and consistency of the service to protect the residents. So the residents are able to pay for performance of worker and can make a public reporting about the nursing home service. So the elderly also can be more protected by the policy and instrument that include in law and certification terms. Alright, that's all from me. Thank you.